So we're going to take a look here at the musculoskeletal system. When we talk about the musculoskeletal system, we are going to be discussing both the bone and bone tissue as well as skeletal muscle tissue. And we're going to start here looking at the skeleton itself and the structure of bone and bone tissue. So let's talk a little bit about the general characteristics that we'll see within the tissues of the skeleton, and then we'll take a look specifically at bones and the tissue that make up bone. So when we look at the tissues and the cells that we'll see here, we'll see cartilage, we'll see dense regular connective tissue, we'll see uh, some non-dense regular connective tissue, we will see bone connective tissue. If we're looking at the tissues in terms of the cells that we see, we delineate whether they are at rest, whether they are building, or whether they are recycling the tissue. If a cell is at rest, it is simply referred to as a site. And so in this case here, we are really looking at three distinct types: the chondrocyte, the fibrocyte, and then the osteocyte. If those cells are building the tissue, we will refer to them as being blasts, B-L-A-S-T. If, on the other hand, those cells are recycling the tissue, we'll refer to them as clasts, C-L-A-S-T. So the first tissue that we're going to look at here before we get into bone itself is the cartilage, and we have three distinct forms of cartilage that you'll see here. The first one is the hyaline cartilage. The hyaline cartilage is recognized by its regularly arranged lacunae with chondrocytes within it. We will see the hyaline cartilage within the developing fetal bone, forming the scaffold on which ossification will take place. We will also see them on the articulating surface edges of the bones, as well as within the epiphyseal plates of the long bones. These will be the principal tissue that we see within the costal cartilage, as well as within the nasal cartilage. The next we see are the fibrocartilage. And when we're looking at fibrocartilage, we will find them in the discs, such as the intervertebral discs, the pubic symphysis, and the menisci of the knee. We can delineate the fibrocartilage based off of the single linear arrangement of the lacunae and the increased collagen fibers that we see within the cartilaginous matrix. The last is the elastic cartilage. The elastic cartilage is noted by its haphazard arrangement of lacunae and the increased elastic fibers found within the cartilaginous matrix. We will see the fibrocartilage in areas of the skeleton, such as attached to the temporal lobe, temporal bone, forming the pin of the ear. The other principal form of tissue that we'll see will be dense regular connective tissue, but we will also see things like loose tissues such as adipose, and we will see liquid connective tissue such as with blood and interstitial fluid. The principal dense regular connective tissue we'll see is going to be forming the osteolayers. The principal osteolayer will be the end osteum and the paraosteum. But we will see this dense regular connective tissue forming the canicules within the herbacean systems. We will see them forming the capsules of the synovial joints. And we'll see them forming the ligaments of attachments between bones. The principal tissue that we will see within the skeletal system is bone. The principal form that we're going to see of tissue is bone. In bone, we can classify it two ways. We can classify it macrostructurally or we can classify it microstructurally. The macrostructure are the actual structural bones that we look at, such as long, short, irregular, flat, and then sesamoid. Now, we have four principles and then a fifth classification of macrostructure. Sesamoid does not actually fit into the actual classification structures that we look at when we look at bone classifications. However, we have to reference it as its own structural form of bone. The sesamoid bone is the bones that we see within connective tissue. The most prominent of these sesamoid bone types is the patella. Microstructurally, we discuss it based off of how the Hervatian system is set up and where we see the tissue itself. So the microstructural is about the tissue, whereas macrostructural is about the structure. And microstructurally, we have trabecula and we have cortical. Trabecula is to the medullary part of the bone, whereas cortical is to the lateral side of the bone. Trabecula have a haphazard arrangement of Hervatian systems, whereas cortical have parallel Hervatian rings. So let's take a look at the bone classification. So here are our four principal forms that we look at. Flat bones making up most of the bones within the cranium. Irregular bones like the scapula and vertebrae. Long bones like the femur, humerus, radius, ulna, the bones of the extremities. Short bones such as tarsals, carpals, and then sesamoids like the patella. When we look at these macrostructural bones, the macrostructural bones have distinct regions within them in which we have the epiphysium, diaphysium, metaphysium, articulating edges or articulating cartilages, the cortical rings, which your books will reference as compact bone, and trabecular spindles, which your book will reference as spongy bone. But what we have to remember is that all bone is compact. It's a misnomer and a misconception as to compact and spongy. And the reference for spongy is an indication of how it looks similar to a marine sponge, even though it doesn't look like a marine sponge. It looks more like coral. And so if we wanted to be technical, it should be coral bone, but it's actually trabecular bone. And we'll take a look at what that means in terms of trabecula as we move through the microstructural discussions here. And then two forms of bone marrow. We have red bone marrow and we have yellow bone marrow. Red bone marrow is the contents of blood forming cells and is typically found within the epiphyseal trabeculum. Yellow bone marrow is bone marrow that is predominantly fat with a little bit of collagen and is found within the medullary cavity. So let's take a look at this macrostructure of the bone, looking first at the long bone and then at the flat bone. So in the long bone, we have distinct areas of importance. So we have the epiphysium. The epiphysium is the two edges or two ends of the bone. It's going to be both the proximal and distal region of the bone relative to the epiphyseal line or epiphyseal plate. We then have the metaphysium and the diaphysium, which is going to form the majority or body of the bone. Lining the edges of the epiphysium is the articulating cartilage. Entering into the bone through what are referred to as the nutrient foramens are the nutrient artery, nutrient vein, and nerve to the bone. These will traverse through the bone through the medullary cavity in the long bone. There is no medullary cavity in the flat bone. In terms of the bone tissue itself, we have the trabeculum to the central core of the bone, and then we have the cortical which forms a ring structure to the lateral aspect of the bone. We then have the flat bone. Notice that in the flat bone, we do not have the medullary cavity. We still have the trabecula and the cortical bone rings and trabecular structures. And then we have connective tissue that is running throughout. To the medullar surface of the bone around the trabecula, we have end ostium. And then covering the cortical rings, we have structure known as paraosteum. The endosteum and paraosteum are hard, fibrous connective tissue that is flexible but keeps the bone intact so that the bone tissue itself will not succumb to forces applied to it during normal movement patterns. And so if we look at this connective tissue, to the internal surface we have the endosteum, and to the external surface we have the paraosteum. The paraosteum is going to have what's referred to as perforating fibers. The perforating fibers are going to form a connective tissue layer that runs through the canicules that forms tunnels that allow for the passage of fluid through the bones, allowing for fluid to move into the lacunae. The fluid here is blood moving through the lacunae in a circulating fashion. These perforating fibers will connect directly to the endosteum on the internal surface of the bone. The paraosteum itself is made up of two distinct layers. We have the cellular layer and we have the fibrous layer. This cellular layer is a combination of fibroblasts and epithelial cells, whereas the fibrous layer is dense regular connective tissue. This dense regular connective tissue from the paraosteum will form directly into the ligamental structures that allow for articulations to occur.